Good evening, ladies and gentlemen, and thank you once again for joining us for another very comprehensive press briefing. And of course, as always, we want to thank the Office of the Prime Minister for hosting the Ministry of Health, Wellness and New Health Investment. This evening, we have quite an extensive presentation for you. We welcome among us the Minister of Health, Wellness and New Health Investment, Honorable Dr. Irvin McIntyre, the Permanent Secretary in the Ministry of Health, Letitia Lestrade-Wyke, the National Epidemiologist, Dr. Shaluddin Ahmed, Medical Internist at the Dominica China Friendship Hospital, Dr. Portia Mead. We also have with us the Deputy Chief of Police, Lincoln Corbett, and the President of the Dominica Association of Evangelical Churches, Pastor Randy Rodney. And we'll get right to it this evening as we begin with Dr. Ahmed.
Thank you, Ms. Harry. Honorable Dr. Irvin McIntyre, Minister of Health, Wellness and New Health Initiative, Mrs. Letitia Lestrade-Wyke, Permanent Secretary of Health, Wellness and New Health Initiative, Dr. Portia Mead, Medical Internist, Dominica China Friendship Hospital, Pastor Randy Rodney, President of Dominica Association of Evangelical Churches, Mr. Lincoln Corbett, Deputy Chief of Police, and pleasant evening to everyone. The total confirmed cases of COVID-19 are 16. 8 are recovered and discharged from the isolation unit for home quarantine. The other 8 cases are still in isolation unit. Some of them have completed 14-day period and without symptoms for the last 72 hours. These cases are sampled and waiting on laboratory testing. All possible contacts have been identified. A total of 152 contacts have been traced. All but 7 have been cleared. The results for the last 7 contacts are pending. At this stage, a total of 367 PCR tests have been completed. Of these 367, 351 are negative. So far, there have been no deaths due to COVID-19. We are still in phase 3 of the outbreak at this stage, and the type of transmission is called cluster of cases. This has been so far 10 days that we have detected the last confirmed cases of COVID-19. There had been few suspected cases within the last 10 days. However, they were negative through PCR testing. The testing of symptomatic cases are ongoing, and these cases are not many at this time. Our next step of actions is to implement community level testing through random selection of asymptomatic cases. The objective is to actively search for a case that is undetectable otherwise. Social distancing through lockdown or otherwise is working, and this is the only way to break the chain of transmission. We must train our mind that everyone is a potential host for this virus, without exception. There are many uncertainties regarding these characteristics of this virus. There are many questions regarding its mode of transmission and immunity, and information are not readily available. So let us continue to do physical and social distancing, frequently wash our hands, maintain proper respiratory etiquette, wear face mask if you need to go out. The objective is to stop the transmission and let the virus stop to death. With this, I thank you.
Thank you very much, Dr. Ahmed. And as he mentioned, just to reiterate, still at 16 confirmed cases, 8 recovered. But just like he mentioned, this is still not a time to become lax in our practices and protocols. So we encourage everyone to continue to adhere to those. Next up this evening, we have the medical internist at the Dominica China Friendship Hospital, Dr. Portia Mead.
Good evening to all present and to all of our listeners. As protocol has already been established, I will simply continue, giving a clinical update of the situation here in Dominica. The total number of patients who have been confirmed with COVID-19 in Dominica remains at 16. From these 16, 18 have made a full recovery and have been discharged from hospital care. Thus, 18 remain hospitalized as they continue with the required care. One is currently 8 remain hospitalized. One is currently at the Covid-19 isolation unit at PMH, and 7 are at the Covid-19 isolation unit in Portsmouth. So in terms of the clinical management, the first thing that needs to be done is a proper triage and identification of these patients. So early recognition of the patients with COVID-19 is of utmost importance. These patients are categorized into 3 groups. The first being mild cases, mild pneumonia. Those in the second group would be those with severe pneumonia with respiratory rate of more than 30 breaths per minute, or SpO2, or the oxygen saturation, less than 90% on room air. The critical patients will be those with acute respiratory distress syndrome, worsening respiratory symptoms within 1 week after diagnosis is made. Supportive therapy is the practice that we have been doing at our health institutions. So oxygen is administered to patients who have respiratory distress, and it is titrated or given as much as they need to maintain their oxygen levels between 92 to 95%. These patients are given antibiotics for those who present with any form of sepsis. So the asymptomatic patients, or those with mild symptoms, fevers of 98.8 to 100 degrees Fahrenheit, presenting with a mild cough, sore throat, lower oxygen levels than normal, and those who are less than 70 years old, but with no chronic diseases. These receive paracetamol to lower any temperatures that they may have, fevers, azithromycin, the antibiotic, oseltamivir or Tamiflu, and vitamin C. At this point, I would really like to pause and to stress that every member of the public ought to be taking at this time vitamin C in order to boost their immune systems. So the patients who present with a more severe form of the disease, and we have had, these are given, yes, the antipyretic, but they're treated with a different antibiotic, which is called levofloxacin. So once the patients remain asymptomatic, so they remain within our care. We treat them for 14 days. And once they remain asymptomatic, after 48 hours, they will undergo testing. And this test is a swab of their nasal and their nasopharyngeal or oropharyngeal or and areas, right? So this is a nose swab and a throat swab. So once the patient has two negatives, so two sets of tests are done within 24 hours of each other. And once both result negative, then the patient is allowed to be discharged to return to their homes where they undergo 14 days of quarantine at home with strict instructions. Subsequently, follow-up visits will be done to review their blood tests, including kidney and liver function tests. All the patients who have been admitted, who are presently admitted, are asymptomatic or are clinically stable. 2 of the remaining 8 patients will likely be retested with the view of their discharge by early next week. To date, none of our patients have required mechanical ventilation. Neither have we had any deaths due to COVID-19. If any of their tests, which is the 2 sets of swabs, viral swabs, that will be done after 48 hours of no symptoms, if anyone, either the first or the second, return as positive, then the patients will not be able to be discharged. They will further undergo 14 days of hospitalization with the adequate care, and after 14 days, they will be retested, and once these results prove negative, at that point, they will be discharged. We do need to remind the public, as per orders of the Ministry of Health, that the hospital remains in emergency mode, meaning that all clinics are cancelled and only emergency surgeries are being done at this time. The Accident and Emergency Department remains available for all emergency situations. No visitors are allowed at the hospital as we attempt to protect our hospitalized patients from any possibility of being infected from visitors coming into the hospital. And it is not only from COVID-19, but other viruses and bacteria which may further compromise the health of these patients. One family member or friend is allowed to bring personal items to patients in the hospital. These people are asked to wear a face mask when coming to the hospital, and they are required to cooperate and stop at the entrance of the hospital for the screening checks that are currently being carried out. The hotlines remain available if any member of the public has questions or need clarification on any health situation which may arise pertaining to respiratory illnesses. We urge the public to call the hotlines instead of simply going to the healthcare centers or to the hospital if one thinks that they may have been exposed to the virus. We have to reiterate that the preventative measures put in place are our best defense against this virus. Please adhere to the techniques of social distancing, hand hygiene, cough etiquette, as these are the only proven methods to combat this deadly disease and to flatten the curve. Thank you very much.
And thank you very much to Dr. Portia Mead, Dr. Mead and her colleagues at the Dominica China Friendship Hospital. They continue to work tirelessly because, as we can well imagine, it's not only COVID-19 that they have to deal with, but there are the other situations, medical situations that will arise, that continue to arise, that they have to work with. So thank you, Dr. Mead and the staff at the hospital. And next up this evening, we have the president of the Dominica Association of Evangelical Churches, Pastor Rodney.
Thank you, Ms. Harry, and protocol already established. Good evening, everybody. These times are trying times. These times are stormy times. These times are times that we all must make up our minds to weather through. And I'm glad that I received an invitation from the Honorable Minister to share a few thoughts with you, especially coming from the Dominica Association of Evangelical Churches. As backdrop to that, I want to read two verses from the scripture, Psalm 29, 10 and 11. And verse 10 says, "The Lord sat as king at the flood." Yes, the Lord sits as king forever. The Lord will give unyielding, impenetrable strength to his people. The Lord will bless his people with peace. Those two verses come from a backdrop where David is speaking about storms. And he's speaking about the voice of the Lord in storms. This COVID-19 is no Hurricane Maria, but in many ways, it is more impactful than Hurricane Maria in many ways, because it's impacting every sector of our society. Every single person can be touched, will be touched eventually. It's impacting our health, it's impacting our security, it's impacting our economy, it's impacting our social way of life, it's impacting how we live our weekends now. It's impacting every sector, every place of society. And even listening to the epidemiologist and Miss Dr. Portia Mead, the internist, and other medical professionals, we are coming to realize, even increasingly, that we really don't even have a finger yet on this novel virus. So there is talk of how it can be spread. We are glad that so far in Dominica we are doing fairly well. Listening to Dr. Ahmed and knowing now that it's been 10 days that we have not had a new positive is good news, is welcome news. But listening to the international medical practitioners, and they say to you that this virus can live in the air for quite some time, is also probable cause for infection, which means, my friends, that it seems that no human person have a handle on this. And if no human person have a handle on this, we need to submit our wills, our desires, our expertise into the hands of He who is very well able to give us handle. And that's God. And David in Psalm 29, I think, puts it very well when he says that the voice of the Lord is strong in the storm. And in verse 10, he says the Lord sat as king in the flood, which means that there is nobody else who can be in control of any flood, of any storm, than the Lord. This tells me that God is in the Kingdom of Providence, the government of providence. God is to be praised as governor of the world. He sits on the flood, not just anywhere else. In other words, he's captain of whatever is happening. He is not wondering what's happening. He knows what's happening. He knows what is to happen. He sits as king forever. So not only does he take position number one, but he's there eternally. What does that mean? It means, my brothers and sisters, my friends, that God is involved in the ebbs and flows of life. He's involved in the agitations and revolutions of this world. In other words, whatever happens, however it happens, does not really matter because he sits as king. Hence the reason why we all must submit to him. But not only does he sit as king, verse 11 says, he will give unyielding and unpenetrable strength to his people. And that is fantastic. It's fantastic because in God's economy, in God's mind, he looks at all of us, whether we deserve it or not, and he decides to provide for us strength that is unyielding and unpenetrable, so that every one of us can have the capacity to go through COVID-19 and come through COVID-19 stronger than we went into it. I submit to you, my friends, that if we make up our minds to yielding to God and God's direction and God's providence, that he, as the one who rules in the kingdom of grace, is able, very well able, to give us what it takes to go through this. What does that mean, that he rules in the kingdom of grace? He bestows favor upon his people. He qualifies us for his blessing. Truth is, not many of us, if we stand before God, can say that we qualify, but he qualifies us. And that is happening, to know that God qualifies us. If we look back at our lives, we can name some things that we didn't do very pleasantly. But God qualifies us. And so in the midst of your worry, in the midst of your concern, in the midst of your pain, in the midst of your anxiety, in the midst of your fear, God qualifies us for his blessings. He fortifies us against every evil work. So whether you think COVID is conspiracy, 5G, demonic, whatever it may be, God fortifies us for every evil work. And guess what? He furnishes us for every good work. He gives us the capacity to do every good work. Hence, I want to leave a few pieces of advice with you, because I love to emphasize the positive rather than the negative. So he furnishes us for every good work. There are some things that he gives us the capacity to do. Number one, he gives us the capacity to protect ourselves and those around us. We have had advice from the medical practitioners and those who function in that area. And I often say to people, your best advice is to follow the best advice. And the best advice must come from the people who know better than you. And ladies and gentlemen, we must not be like a gentleman that I used to know. He said, he went to the doctor and the doctor said to him, your liver is in trouble. So you need to stop drinking alcohol. He says, in Creole, well, if you really want to get COVID-19, do what you want. But if you want to protect yourself, then you need to be smart about this. Very smart about this. And the anguishing thing about this is that once you are diagnosed with it, then you get into isolation. Isolation from everybody you love. And everybody who loves you. Consider that. So protect yourself and protect those around you. Number two, you and I need to get to the place where we provide physical, mental, emotional, and spiritual healing to all those around us, especially those affected. And I list physical, mental, emotional, spiritual because they are all important. They are very, very, very important. In my capacity as pastor, over the last few weeks, I'm inundated with people who call because they're fearful. I'm inundated with people who have been tested positive, who are not sure how they're going to go back into their communities, people from their communities are threatening, we don't want you back here. And I want to say to every Dominican, every person listening to this, that every person who's been affected is your brother. And you could have been them. Guess what? Open your arms and receive them with all the love that you are able to give. Yes, we are warned about physical distancing, so let's be cautious about that. But provide them with all the emotional support that they will require as they come home And I'm heartened that 8 of them have been discharged, and I'm sure by God's grace many more will be discharged. And as they are discharged into their communities, as they are discharged into your community, open your arms and receive them. Extend love. And love in its application is in the expression of compassion and mercy. The expression of compassion and mercy is the character of love. And so every one of us must get to the place where we do that, where we express love. God gives us the capacity for every good work. Thirdly and finally, we have capacity to give thanks to those who deserve thanks. And I want to pause to give thanks to all the frontline people, all of you. Whether you are the doctors, the nurses, the ambulance drivers, the cleaners, wherever you are, the police, every one of you. And I thank you because really and truly you're putting your life and the life of your family at risk. The truth is, I'm not sure I want to be you. So I thank you for being you. Really profoundly from my heart, I thank you for being you. Because I am not sure I want to exchange places with you. I've spoken to nurses who say, this is the time when they wish they weren't a nurse. Right? I've spoken to medical people who say, this is the time when they wish they weren't a medical practitioner. I do not want to be you. But I thank you for your service. I applaud you for what you do. And I want you to know that I pray for you and the community of the Dominican Association of Evangelical Churches. We keep you in our prayers daily because we believe that you are doing a good work and you deserve to be thanked. We appreciate you for it. If we didn't appreciate you before, I tell you this time, we do appreciate you. I drove through the hospital a few days ago to bring in somebody who was had an emergency. And I stopped at the gate and they took my temperature and I go like, excuse me? You know, we appreciate you. We thank you for doing that. So even those at the hospital gate who take the temperature, we thank you because you are yourself putting your life at risk. I felt I was at risk. I did not know what the person had. But I had to be in their company and take them to the hospital. Consequent on what's happening now, the DAC has taken some very bold initiatives and we are planning on some more. One of them is most of us, all of us are doing online church. And so we are able to communicate with our people and speak with them and encourage them because we believe at this time, this country should be praying. If you're a praying person, pray. And I believe that yes, the medical professionals are doing the human effort to cause this thing to happen. But we need to undergird them with prayer. Because I'll tell you something, one of the pieces of counseling I give to somebody is something I've learned in my profession. And that is when you get too accustomed with something, you can make mistakes. And even doctors and nurses can do that too. You know, making mistake in the COVID environment is something that's very easy. Your customer doing this, you put your PPE, you make an error in putting it on or taking it off, and you put yourself at risk. We pray for you because we believe that while you put your effort in there, the possibility of you endangering yourself is real. And we believe that God is protecting you. In fact, our prayer at our church is that God gives you his own PPE. Whatever equipment you have might be good, but we believe that whatever equipment God will give you is better. God will give his own PPE. So we have online church and we pray. We're hoping to establish an online spiritual counseling hotline. In this time, we've been dealing with people who are suicidal. We've been dealing with people who are depressed. And, a couple of times, some of us have to run to them, stay far from them, but run to them. We want to establish a hotline where people can call us anonymously and we can provide counseling for them. And we're hoping that as we keep talking to our partners, we'll get some partners involved in ensuring that we have a hotline where Dominican people can call for help. Call because they need some support, some lifting. And finally, we're advising our churches to do some retrofitting of washrooms to make for upgraded sanitation. Most of our public washrooms all over the country, in churches and otherwise, are not properly retrofitted. And so we're advising our churches to begin to think about that. So when you go into your washroom, the public washrooms in particular, and you're walking out of those washrooms, you don't have to touch a knob or touch a door. once you have washed your hands. Once you have washed your hands, you should be able to walk out of that washroom without touching anything. That, I'm sure, will help us now and in the future. Of course, that is dependent on financing. I want to ask every one of you to keep providing support, and those of you working assiduously to ensure that we not only flatten the curve, but we go back down to zero. I want to thank you and ask you to keep working hard for us. Thank you very much.
Thank you so much, Pastor Randy Rodney, and we want to thank you for that inspiration and for the support that you have pledged and you continue to provide for the general public. This evening, we also have with us the Deputy Chief of Police, Lincoln Corbett, who is our next presenter.
The Honorable Minister of Health, Dr. Irvin McIntyre, National Epidemiologist, Dr. Amid, Medical Internist, Dr. Mead, Pastor Randy Rodney, President of Dominica Association of Evangelical Churches, PS, Minister of Health. Dominicans, good evening. It is indeed a privilege to update you on the progress made to date in relation to the policing of emergency powers, Order SR number 15 of 2020. I can report that our patrols on land and on sea continue to yield results. The aim of the police force is to ensure that citizens and residents adhere to the conditions of the curfew order so as to prevent the spread of Covid-19. A vast majority of Dominicans are generally adhering to the curfew order and the guidelines are set out by the Ministry of Health. This weekend, from 6 p.m. on Friday the 17th of April to 6 a.m. on Monday the 20th of April, the country shall be on total lockdown, meaning you shall stay in your home. You are therefore warned to stay indoors, unless if you are permitted to be out there. Anyone found in a public place without being exempted will be arrested and prosecuted. To date, 31 individuals have been arrested for breach of the curfew order. Including this number are 15 people from the village of Portsmouth who, on April 13th, took part in a wet fete. This was held on the public road in Portsmouth, and they were arrested subsequently. They were taken to court, and 14 of them pleaded guilty and were each fined $500 to be paid immediately. These people were in breach of the curfew order by failing to adhere to the conditions stipulated therein. I wish to warn both captains also that they will face the full brunt of the law if found violating the laws of Dominica. In the previous broadcast, I issued a stern warning to both captains, boat owners, crew members, and people who are involved in entering the state illegally. I reiterate this evening that you have to desist from this practice. We will use every legal means to ensure and enforce compliance with this order. We will stop you by any means necessary. I wish to call on members of the public to report any sightings of illegal entrance or information in that regard. They are putting your life and the security of the state in jeopardy for their own selfish deeds. Therefore, it is your duty to stop them by reporting them. This disease, as I indicated before, is a threat to our national security. Our way of life, and if not dealt with swiftly, could be disastrous. Our initiative, by partnering with the Roseau Market Authority, the WASC and DOMLEC, to reestablish order and to implement social distancing and other measures as directed by the Ministry of Health, appears to be bearing fruit. They have been well received by the public. In this regard, I wish to thank members of the public for the cooperation and adherence to the measures in place. Although not related to COVID-19, on April 13th, 2020, we responded to a report of domestic violence in the village of Grand Fond. It was reported that 2 young ladies from the community had sustained life-threatening injuries. In a hot pursuit which lasted over 48 hours and taking up much of our resources in the fight against COVID-19, one St. Lucian national was arrested and charged with attempted murder. He is currently on remand at the Dominica State Prisons. Due to the nature of our functions and our duties, the police force has always placed safety and protection of our officers as a matter of high priority. Prior to any cases of COVID-19 on the island, the force prepared and circulated broadly the law enforcement COVID policy document for strict compliance, that is, by all. A COVID team was established to provide training and source materials and resources to equip police officers. Therefore, we are fully prepared. However, on Thursday, April 9th, 2020, we received the dreaded news that one of our officers had tested positive for COVID-19. We moved swiftly to compile a list of all contacts within the force. And that very day, 32 officers were swabbed and quarantined. I am pleased to report that they all tested negative for COVID-19 and will soon be back on duty. This, I suggest, can be attributed to the officers adhering to the protocols, including social distancing and safe hygiene practices. I wish to place on record our sincere appreciation to the conscientious and hardworking police officers who make themselves available during this critical and testing time. They are all fully aware of the risk associated with battling COVID-19. Our sincere thanks for their sacrifice and commitment. Our thanks to the government of Dominica and other stakeholders who continue to provide invaluable support to the force. I also want to thank the general public for cooperating with the police. In closing, I remind the general public that this weekend, starting at 6 p.m. today, that is Friday, 18th April, to 6 a.m. on Monday, the 20th of April, the country shall be on a total lockdown. You are to stay at your home. I also implore the general public to follow the guidelines by the Ministry of Health to prevent the spread of the deadly COVID-19 and to obey the orders as stipulated in the SRO number 15. Failure to adhere to these conditions will result in dire consequences, including the risk of being prosecuted. I pledge our commitment to continue to collaborate with all stakeholders to return Dominica to a state of normalcy within the quickest possible time. Thank you.
And thank you to the Deputy Chief of Police, Lincoln Corbett. We want to thank him for always being so willing to present at our press briefings. We continue to urge the public to cooperate with him and his fellow police officers as they, like he said, put themselves at risk for our own safety. And our final presenter for this evening is the Minister of Health, Wellness and New Health Investment, Honorable Dr. Irvin McIntyre.
National Epidemiologist Dr. Shalauddin Ahmed, Medical Internist Dominica China Friendship Hospital Dr. Portia Mead, Permanent Secretary Ministry of Health Mrs. Letitia Lestrade-Wyke, President Dominica Association of Evangelical Churches Pastor Randy Rodney, Deputy Chief of Police Mr. Lincoln Corbett. Pleasant good evening to all of you. As usual, it's not only our duty but our pleasure to be here with you again, updating and educating you with the hope of keeping you focused on the job at hand and thereby maintaining and improving our preparedness at all levels. We all know that everyone must be part of the fight against COVID-19 because any one of us can be a victim of COVID-19 as well. It is now 10 days since we've recorded our last positive case of COVID-19, but we are all aware that the fight against COVID-19 is far from over. We must remember this is a new disease surrounded by great uncertainty, and as such, the world is still learning about this deadly virus. We cannot be naive and become complacent in our actions and our attitudes. This relatively stable state that we're presently in gives us more time to focus on case identification in our communities, rather than letting our guards down. The Ministry of Health will continue all efforts with the intention of achieving the best possible outcome for our country. But the Ministry of Health cannot do it alone. Besides our activities on the field, we have placed much emphasis on risk communication and community engagement through the Health Promotion Unit. We know that knowledge is power and ignorance is poverty. We urge the people to adhere to and follow the guidelines being echoed by the Ministry of Health. And I will repeat, frequent proper hand washing, proper respiratory etiquette regarding how we sneeze and how we cough, disinfecting and sanitizing our homes, offices, and businesses, proper placement, wearing, and removal of masks, and always remember to wash or sanitize our hands before placement of masks. Practicing physical distancing of at least 6 feet from the individual. We can also step up our level of commitment to the cause by engaging in community policing. If your friends, your neighbors are not adhering to the anti-COVID measures, then engage them from a distance or on your phones. Explain to them the significance of their actions. It is also important to recognize any new person in your community who came from abroad for whom we have no record of. In that case, please feel free to inform the police or the health authorities. This might just be your intervention in saving lives. The weekend is here, and it brings along the total lockdown. But by doing this, we're also locking down the virus and keeping it stranded. We've done it before, and we can do it again. Before I close, I must mention that we have been fortunate to have good friends internationally. This morning, the People's Republic of China donated 15 non-invasive ventilators and 20 non-contact infrared thermometers. In this present scenario, we know how valuable such a donation is to our country. That is besides the 30,000 masks and 1,500 PCR test kits we received last week. And there will also be much more supplies in the coming weeks from the People's Republic of China, to include PPEs, that's the personal protective equipment, N95 masks, non-contact infrared thermometers, and test kits. We also express our deepest thanks to the Bolivarian Republic of Venezuela for making available 50 PCR test kits and 300 rapid COVID-19 tests, which we will use for our community studies. The government of Cuba has been at the forefront of making medical professionals available to fight COVID-19 throughout the region. Dominica is no exception. The 35 Cuban health professionals are actively involved in our response to COVID-19, and for this we are very grateful. Our second COVID-19 unit at St. James in Portsmouth is complete, and that gives an additional 18-bed capacity. Special thanks to Dr. Colin McIntyre, Honorable Kasani Laville, and Permanent Secretary Mr. Roland Roy, together with the contractor and all the construction workers for the effort in achieving this milestone as regards to our surge capacity. It is important to note that most of the persons who provided apartments for staff accommodation and quarantine, meals for our staff and persons in quarantine, transportation for our staff, construction materials and labor, washers, dryers, furniture, and other hardware materials, were doing so without mentioning pay, because they put country first and trusted the government to honor its responsibilities as regards to pay. The government of Dominica is processing a contingency fund for COVID-19 activities specifically related to health. This is the COVID emergency response. I would also want to express our sincere gratitude and appreciation to all the local companies who have assisted us in one way or the other. Last but not least, there are no words to express the significance of our frontline workers, both at the COVID unit and the field, in this fight against COVID-19, also to include the quarantine team. And for this, the Ministry of Health and the country by extension would like to say that you are the true patriots, risking it all for the good of all. I thank every Dominican for being part of our COVID-19 response, and I also wish every Dominican a safe weekend. I thank you, and may God bless Dominica.
And thank you so very much, Dr. McIntyre. And on behalf of all the staff of the Ministry of Health, I'd like to extend my gratitude to you. You are the glue that keeps all of these organizations that you mentioned, all of these individuals that you mentioned, you're the glue that keeps it all together. So thank you for your leadership and continued support of your staff. I'd also like to acknowledge quite a few other individuals. I want to acknowledge Open Solutions for Health. And that company is responsible. They came on board to develop the database that's being used by the Hospital Information Unit and did so free of charge as part of their corporate responsibility. So we'd like to extend our gratitude to them. I'd like to also thank the Permanent Secretary in the Ministry of Health, Letitia Lestradwijk, and the administrative staff in the Ministry of Health. They all work behind the scenes very diligently. We don't hear about them very often, but they are there. Even when other staff of government staff was sent home, they came into work every day because there's a lot that needs to be done behind the scenes. So thank you to them for that. Our hotline operators, we continue to thank you for your dedication to your service. And we don't usually thank this staff, but I'd like to thank the staff of the Office of the Prime Minister, especially the camera crew. I'd like to thank the GIS crew. They are on the ball all the time, anytime, to bring the information across to the general public. So I'd like to thank them very profoundly. Also, the staff of the ODM for your continued support of the ministry. Thank you for that. The lab staff at the hospital for your prompt and efficient work. Also often neglected our drivers, Frigis, J-Ren, Mr. Pond, Mr. Thomas, and the others. Thank you so much for always being available any time of the day and night. And ladies and gentlemen, I'd also like to thank all the media partners who come on board all the time to provide the coverage and support, and you for your patience, for your compliance, and for always tuning in. Again, we remind you that we do not want you to become complacent in this time, but continue to exercise all the best practices that have been outlined by the ministry. Once again, we wish you a very good evening.